students, welcome to Easyness, where nursing education made easy. As your exams are coming, in this session we will be discussing regarding the medical surgical nursing 2. So, in the medical surgical nursing, there are different chapters, okay? In that, oncology is the main one. Okay, so we will discuss about oncology. Also, we will discuss about some other chapters and the very important, most important questions, okay? And in some last years, they have been repeatedly asked, okay? So, are you guys ready? Let's jump into the session. So, our first question is a nurse's role in drug-resistant tuberculosis. First to know that what is meant by tuberculosis. Tuberculosis is a disease where there will be a severe infection in the pulmonary area, okay, or lungs. It is the reason of the, or it happened because of the Mycobacterium tuberculosis, okay. So, there are different types of causes why this has been triggered or why the mycobacterium actually attack, okay, or what are the risk factors. The risk factors includes pollution, not maintaining a proper hygiene, okay, especially the hand hygiene, okay, and situating or living in a very overcrowded areas and all, okay. This leads to tuberculosis. So now there is a term called drug resistant tuberculosis. So what is mean by that? When, see, in every disease we give some drugs to be treated, right? So in the tuberculosis also we give some drug, and the therapy called is a DOTS therapy. So the DOTS therapy, when the drug will not be working properly, okay, and the drug is not able to treat the disease, then we will call it as drug resistant tuberculosis. So in these cases, what is the nurse's role? How a nurse will react, okay, or how a nurse will do the actions. So in the medication adherence, first we have to, as a nurse, we have to implement the directly observed therapy or DOTS therapy to monitor each dose, that as we are increasing the dose, how the patient is reacting, or whether the symptoms are decreasing or increasing, okay. Then manage the side effects of second line drugs, okay. So when we are giving the second line drugs, we have to see what are the side effects that it's showing, okay, or what are the problems that it's showing. So when we will able to analyze that these are the side effects or symptoms the patient is facing, then we will able to handle it, okay. And example as linezolid, example is linezolid induced neuropathy, okay. So it also have some the linezolid drugs is actually having side effect in the neurons, okay. So we have to manage those side effects. Then we have to provide pill organizer, reminder and telehealth follow-ups, okay. So what is a pill organizer and pill reminder? So there will be a system. We can mention now different types of app have been came, okay, with the message, with the normal follow-up procedure. What we can give the patient a organizer, okay. We can give a organizer box, like there will be different months or different, date will be mentioned, or different days of week, okay. Sunday, Monday, Tuesday, Wednesday, Thursday, Friday and Saturday, okay. So what will happen, in each of the box the nurse will fill each pills, okay, that is required. So as per the prescription, nurse will fill the pills as per the days the patient have to follow up per the prescription, okay. So that is pill organizer, and pill reminders also we have to give the patient. Including that, we have to give the telehealth follow-ups, okay. What is telehealth follow-up? Using the electronic devices such as computers, mobiles, okay. Using the internet, we will give the follow-up telehealth calls, okay. Like we can send a mail or we can send a message for the follow-up care. So that is under the medication adherence as a nurse we can do. Next, move on to the psychosocial impact. So the person who is having the tuberculosis drug, how the society will react, okay, or because of that, what is the psychological impact that is happening on the patient. And for that case, as a nurse, what we can do? So we can address the stigma, okay, we have to break the taboo of that particular disease. Here it is drug resistant tuberculosis, then fear or of infecting family. So sometimes what happened, when a patient or a person in the family gets infected by tuberculosis, at that time the family member will not accept the person, okay, or they will properly completely isolate them, they will not touch them, they will not try to be mingle with them, okay, they will completely avoid the person. Sometimes they will make the person out of the house also, okay. So that superstitions and stigma or taboo, it is still there, so we have to fight with that, and long term isolation should not be maintained for a patient, okay. So we have to address those kind of things. Then offer a mental health referrals for depression and anxiety. The patient who thinks the tuberculosis is a lifetime cycle and the therapy is for the lifetime, for those patients we can give the mental health referral, especially the patient who are feeling depression because of the disease, okay. So we can give the psychosocial support. Then support the reintegration into work, school or post treatment, okay. So after completing the treatment, after completely being cured, okay, what we can do, we can give the support to be again join in the college or schools, okay. So we can give those instruction to the patient, because continuously if the patient will be out from the work area, out from the environment of everyone, completely isolating, patient can go to depression, okay, and that can worsen the situation of their health. So that's why we should support the reintegration, okay. So that is under psychosocial impact. The next one is community safety. So what is community safety? We have to educate on the infection control, okay. Infection control in the sense, mainly the tuberculosis happened because of the droplets of the cough or sneeze, okay. So that body fluid exchange, so we have to tell the patient to use mask and cough hygiene in the sense, after coughing or when the patient is coughing, okay, he have to carry always a handkerchief, okay, or use and throw tissues, okay. Also, if the tissue or the handkerchief is not available or any cloth is not available at that time, what he can do or she can do is, he can cover their mouth with the elbow, okay. We can cover our mouth, so the droplets will not be passing or will not be spreading through the air. Also, for the patient after the coughing, they should always wash their hand or use a sanitizer, okay. So that is the first step. Next one is coordinate screening and prophylaxis, okay. So we have to tell the patient to coordinate with us. Also we have to coordinate with the patient for the screening and proper prophylaxis of the disease, okay. Then prevent the community transmission through the contact tracing, okay. So we have to take tracking, okay, for the patient, and we have to monitor them. Then lastly, the national surveillance role. So in the national surveillance role, as a nurse, what we can do, the steps we can take is ensure the accurate reporting to National Tuberculosis Individual Program and RNTCP, okay. So for both of them we should always report, like if a new case is coming, if the person with tuberculosis have died, or the person is after giving the dots also person is being the drug resistant, this kind of cases, everything we have to be record and we have to report to the NETP and RNTCP, okay. Then submit monthly reports on the adherence like sputum status and the ADRS. Then we have to support the public health goals by ensuring the treatment completion. Okay, so we should always check on the patient who are having tuberculosis that they are getting the complete treatment. Okay, so that is all about the nurse's role in drug resistant tuberculosis. Our next question is holistic nursing management in advanced HIV and Kaposi's sarcoma. Okay, so see holistic, what is mean by holistic roles? A holistic roles is actually all-rounder role. Okay, so as a nurse what we actually do, we actually provide care. Okay, we provide care, we provide, so we give the mental support, okay, for psychological support, we give the counseling, we do the advocacy and all. Okay, so so for the holistic management of holistic management in advanced HIV and Kaposi's sarcoma, as a nurse what we can do, let's see. The first of all we have to know what is mean by HIV with Kaposi's sarcoma. So Kaposi's sarcoma is nothing but a tumor that is associated with the human herpes virus 8 infection, and it is the most common AIDS defining illness. Okay, it is the most common AIDS defining illness. So the Kaposi's sarcoma is a cancer that forms in the lining of the blood and the lymph vessel. Okay, so the cancer or the sarcoma is actually happen in the lining of the blood and lymph vessels. It is commonly associated with advanced HIV AIDS. Advanced HIV AIDS in the sense human herpes virus 8 infection. It presents as a purple or brown skin lesions that may affect the internal organ. Okay, or sometimes also there will be some nodules or purplish, brownish or bluish colored lymphs or nodules that will present inside the mouth. Okay, you can see on the skin and neck especially. So what is the clinical management? Okay, so first of all, no, in the case of this HIV with Kaposi's sarcoma, mainly the symptoms will include bleeding, coughing, vomiting, okay, tiredness, fatigue, okay, and continuous fever. Okay, so the main clinical management is lesion monitoring. Observe this. So first, to monitor the lesions, we have to observe the skin and the mucosal lesion progression, okay, such as bleeding and sick. Then ART administration. So in the ART administration or antiretroviral therapy administration, we have to ensure the strict adherence to antiretroviral therapy to suppress the viral load and boost the immunity. See, in this case ART is very important, because if we are not able to suppress the viral count in the blood, we will not able to give any treatment, and if we give treatment also it will be not effective, or the drugs will not be effective. See, HIV is non-curable, okay, but still we can keep the patient, keep the patient live, okay, with the treatment. Okay, so if we are not able to give the ART administration properly, then the patient will not be surviving. So it is very important. Next is chemotherapy. So chemotherapy, you all know, it is a kind of a drug therapy where we will kill the cancer cells with the drugs. Okay, so administer chemotherapy, example as limposol, doxorubicin, and when the Kaposi's sarcoma is extensive or internal, in that cases only we can give the chemotherapy. Then infection prevention, provide the prophylaxis and monitor for the opportunistic infection in the sense the pneumocytosis, universally pneumonia. Okay, it will worsen the condition of the patient. Now this is about the clinical management. Okay, this is about the clinical management. Next we will move on to the palliative and quality of life focus. So what is that? The symptoms. First, as the palliative and quality of life focus, we have to relieve the symptoms. We have to suppress the symptoms. See, because HIV is non-curable disease, we can't treat it properly, or we can't treat it 100%. Okay, but there what we can do else, we can give the symptoms relief, such as manage the chronic pain through the analgesic and all. Then we can manage the breathlessness, anorexia, or lack of eating, or decreased amount of eating, and fatigue with the appropriate medication and the therapies. Then end of life planning, which is discuss advanced directives, preferred place of care, and spiritual needs. And culturally sensitive care, such as provide respectful individualized care aligned with the patient values and beliefs. So that is about the palliative and quality life focus. Then lastly, stigma and psychosocial care. So first we have to do is counseling. Okay, that is very important to address the stigma that the patient is feeling, then fear of disclosure, job loss, and social isolation through the empathetic counseling. Then support groups, which will encourage the patient in participation in peer support and HIV advocacy networks. Lastly, the mental health support, such as screen for depression, anxiety, and refer to mental health professional if it is needed. Okay, so that is about the holistic nursing management in advanced HIV or with kyphosis sarcoma. Our next question is rheumatoid arthritis. So what is rheumatoid arthritis? It is a chronic or a severe situation where because of the infection the synovial joint will get inflamed, and it will because of that the symptoms such as painful walking or painful knees, okay, painful joints will be seen. So what is the definition? So a chronic systematic autoimmune disease which causing the inflammation of synovial joints leading to pain, deformity, and disability of the person. Now what are the causes? The main causes are usually unknown, likely due to combination of genetic, immunologic, and environmental factors. So what are the symptoms of this disease? The symptoms include morning stiffness. It will be more than 1 hour. Okay, so the patient, when the patient will wake up in the morning, they will not able to move their body, okay, or any part. There will be complete stiffness, and if they will try to move, there will be a severe pain. Okay, so the morning stiffness will be more than 1 hour. Okay, remember that is a very important symptom. Next one is swollen, warm, tender joints. Joint in the sense you can understand, no, these are joints with movable or unmovable joints. Okay, symmetrical. There will be swollen and warm, and the place will be very tender. It will be hard also, and if we will press over there, it will start pain for the patient. Then fatigue and low grade fever. Rheumatoid nodules. Now what are rheumatoid nodules? So because of the rheumatoid arthritis on the places of joints, you can see over there if it is a skin. Okay, so you can able to see some nodules which are actually the lymph nodes. It will be swollen. Okay, from outside of the skin it will be visible. Okay, and there will be low grade fever also. So those are the symptoms of rheumatoid arthritis. Now what is the nursing management? The nursing management include assessment. Okay, what we have to assess the joint pain, how much is the grade, how the patient is feeling, when the frequency of the pain and the severity of the pain we have to assess. Then range of motion in the sense how much patient can able to walk, they can able to sit or not, they can walk properly or not, that we have to assess. Then fatigue and lab tests such as RA factors, ESR, and CRP. Okay, so this thing we have to assess under the nursing management. Then pharmacological treatment. What are the pharmacological treatments are there? At present, NSAID for the pain or non-steroidal anti-inflammatory drugs. Then DMRD, example as methotrexate. Biologics, example infliximab, and corticosteroid for the flare-ups. These are the pharmacological management. Now non-pharmacological management, we can get heat for the stiffness, so the blood circulation will be increased, okay, and cold for the inflammation. If it is there is way much inflammation in the particular joint or the area, we can give the cold compression. Then splints, rest and balance exercise we can give to increase the motion of the patient or motility of the patient. And lastly, joint protection education is needed, like using of cod liver oil, okay, or consuming cod liver oil, then how to mobilize our body and how much exercise is needed, yoga and all these things we can provide in the non-pharmacological treatment. Okay, so that was about the rheumatoid arthritis. Okay, you understand, right? So if it is any confusion there, you can comment down in the box. I will check and I will try to give all your answers and queries. Okay, so our next question is triage in emergency nursing and mass casualty role. So what is mean by triage? Triage is actually a method where we will prioritize the patient who are critically ill, and we will give the response and we will give the treatment as soon as possible and as fast as possible. So it is a method to prioritize patient based on the severity and survivability to utilize the limited resources efficiently. Okay, so we will not only divide the patient on the severity, we will also on the survivability, also resource that they are having. Okay, so based on this three we usually make the plan of the triage, and it is actually a system. So there is a two system. Okay, one is ESI, which is emergency severity index, used EDs. Level 1 is most critical and level 5 is most least critical. Okay, next start is actually a simple triage and rapid treatment used for disaster tags such as red, which need the immediate care and response, yellow that can be delayed, green is for the minors, and black is for the deceased who are already dead. So I have mentioned a chart here. Let's see. Sorry for that. So I have mentioned a chart here. Let's see what are the priority meaning and what example also we will see. So it will be easy for us to understand about the triage. So first one is red. Red color actually symbolize or actually mean the patient or the victim is needed immediate care. The priority is immediate. Meaning of that, the patient or the person is going through life-threatening situation, but it is treatable. The example are severe bleeding, airway obstruction and shock. Then yellow it is delayed. Okay, so delayed in the sense it means that it is serious but not immediately life threatening. Okay, so the treatment can be little delayed, and the examples are fracture, burns without airway involvement. Okay, next is green. Green is for the minimal or walking wounded, the minor injuries, okay, such as some small cuts, okay, abrasions, minor fractures and all. Then black is for the expectant or deceased who are unlikely to survive or already dead. Okay, example as massive head trauma or cardiac arrest. So this is the color coding we can say, or this is the system of our triage. Now as a nurse, what we can give, okay, in the triage, how we can manage the mass casualty triage. First one that we have to do is rapid assessment, ABC, airway, breathing and circulation. Then assign color tags. We have to assign color tags for all of the patient. Prioritize the life-saving intervention, like red we have to treat first, then yellow, then green, and black we can treat or not, we can ignore. Okay, then reassess the victims and emotional support and documentation of the patient. So that is we can do in the triage in emergency nursing and mass casualty. Okay. You are understanding, right? I am telling you again and again, if any question is there, you just ask me in the comment section, I will give you the answers. Okay, and remember this, if you are not reading all the topics, at least read these topics, okay, and at least know about some gist, so you can explain by your own. Okay, so next question is emergency management of status of asthmaticus. Okay, so what is that? It is actually a life-threatening asthma attack, unresponsive to standard treatment. Okay, standard treatment in the sense normal, what it's called, just inhaler. Okay, so normal inhaler or normal basic or low grade drugs will not able to treat it. So it is a very life threatening situation where asthma attack comes. What are the causes? Causes of allergen exposure such as pollen or peanuts of patient who have severe allergy, peanuts, or maybe allergy with the prawns. Okay, if they get exposed to the triggers, then it can cause the life-threatening asthma attack. You may have seen in serials or movies that when a person is having, severe allergy with the peanuts and they are eating peanuts, after that they are getting severe allergy, and because of the continuous inflammation and all and body heating, the patient will get the shock. Okay, and also it will obstruct their airways. Okay, because the airways will be inflamed because of the allergy. Okay, or allergic reaction. So the first cause is allergen exposure. Then non-adherence to medications and any kind of infection, non-steroidal anti-inflammatory drugs, and beta blockers are the main cause of the status asthmaticus. Okay. Next is symptoms. So what are the symptoms? The symptoms will say severe breathlessness, silent chest. Silent chest in the sense, see, when we are inhaling and exhaling, so what will happen when we inhale, our chest will be little upward, okay, or it will move outward, and when we will exhale, the chest will be moving inward. So there will be a movement in our chest, right? But in for the patient of status asthmaticus, there will be a silent chest. There will be no movement, okay, because they are having the severe breathlessness. Okay, then cyanosis, like because of the breathlessness, the oxygen will not able to reach to the body properly, and you can in the nail tips, okay, in the eye area, in the lips, nose, you can see that black patches. Actually those are not patches or bluish discoloration. Okay, so that is called a cyanosis, and altered sensorium along with the hypoxia and exhaustion. Okay, so these are the main symptoms. Now management. So how we can manage a patient with status asthmaticus? How we can manage a patient with status asthmaticus? So we have to first assess the respiration rate, SpO2 or oxygen saturation, ABG or arterial blood gas analysis, and PEFR. Okay, so these are the things we have to assess first. Then we will move on to the intervention. What are the intervention? High flow oxygen administration. Okay, nebulization of salbutamol and ipratropium. Okay, so it will suppress the inflammation. Also, it will clear the pathway of air moving. Okay, then IV intravenous corticosteroids such as hydrocortisone, magnesium sulfate if IV if it is very severe case, and intubation or if the deteriorating happen. So these are the intervention that we can do as a nurse. And if after that also it is not if the situation it's not suppressing, and maybe it suppress the patient but the patient is not stable, then we can move the patient to the ICU. Okay, ICU transfer criteria include no response to therapy, confusion, drowsiness, and worsening hypoxia. Okay, in those cases we can transfer the patient. So that is about the emergency management of status asthmaticus. Okay. The next one is nursing management of breast cancer. So breast cancer is actually a malignant tumor that is originating in the breast tissue, commonly in the ductal or lobular area. Okay, it can happen in the axillary part of our body, or we can call it as armpit, then any side of the breast. Okay, and it mainly happen for the women or girls. The risk factors include female gender, age over than 50 years. Okay, but in sometimes what happen, no, it can be happen, it is very rare, but it can be happen when the patient is in the teenage, or they are just moving towards adults also, because of some menstruation problem or hormonal changes. Then BRCA mutation of the genes, then hormonal exposure, family history of the patient, like in the family, if their mother, father, okay, or their grandparents have already had the problem, then it can be transferred to the offspring also. Then symptoms. What are the symptoms it include? It include the painless breast lumps, nipple discharge and retraction, or cracking of the nipples. Then skin dimpling. There will be a dimple. Like see, if it is a breast, okay, there will be a sudden dimple which is unexplained. And axillary lymphadenopathy. So in the axial area, what will happen? The lymph nodes, it will be swollen, okay, or lump will be creating. So those are the symptoms of the breast cancer. Now nursing management. For the surgery phase, the pre-operation teaching and post-operation teaching we have to do. We can give the emotional support, we can provide you the knowledge regarding surgery and what are the complications that can come, we can explain to the patient. Then post-operative care like wound care, drain care, and arm exercise is needed for the patient who is having the breast cancer surgery. Sometimes because of the breast cancer, mastectomy can happen. So doctor will, or the surgeon will remove fully, they will remove full of their breast. Okay. So the woman patient can feel very low or very depressed about their body posture and body image. So we can give the mental support. Then chemotherapy, monitor for the side effects such as nausea, neutropenia and alopecia. Then antiemetics such as hydration, nutritional support we can give. Lastly, radiotherapy such as skin care, fatigue management and prevent of the skin breakdown due to chemotherapy, like we can give the proper hydration, maintaining proper moisturizing of the skin. So these are the nursing management for the patient with breast cancer. Next is nursing management of burns. So as we know, the burns are the most severe cases, okay, and especially when it is come to third degree burns. Most of the patient, like 80 to 90% of the patient don't usually live after the third degree of burn. So what is the definition? The tissue damage due to heat, chemical, electricity or the radiation is called as burn. So there are three types of burn: first degree, second degree, third degree, fourth degree. Actually most of the burn come under third degree, because up to fourth degree patient will directly die. Okay, in the first degree burn there will be a redness, okay, there will be no blisters but pain and burning sensation will be present, okay, and the symptoms will be reduced within 1 week. In the second degree burn there will be blisters, there will be redness, there will be itching and severe pain, okay, and there will be burning sensations, okay, water filled blisters will be present. In the third degree burn there will be no pain, because completely the nerves will be damaged, okay, and upper layers of the skin will be completely burnt, okay. So that is called as third degree burn, and in the fourth degree burn up to the muscles or the bones it will be burnt, okay. So those are the types of burn. So what are the nurse's role in the phase? Okay, so resuscitative phase, which is 0 to 48 hours. As a nurse, what we can do? We can give the airway, breathing and circulation. We have to maintain and monitor the ABC of the patient. Okay, then fluid replacement like Prackland formula. Okay, like if it is in front of the body and the trunk, it will be 18%, plus it is the back of the body, it will be 18%, plus if it is head and neck, it will be 9%. So that is Parkland formula, you know, right? Okay, so based on that we have to calculate the severity of the burn, and after that we can give so sorry so based on this, what we can give the fluid replacement therapy. Then pain control and prevent the shock of the patient, because just after the burn, no, if the patient with severe burns, they can get the shock, hypovolemic shock and all. So we have to prevent the shock also. Okay, so that is resuscitative phase, okay, which is in between 0 to 48 hours. Next is acute phase. So acute phase include wound care, which is debridement and dressing of the wound, infection prevention, nutrition like high protein and high calorie diet, emotional support to the patient, okay, who have severe burns. Then rehabilitation phase, in the phase where the completely their identity gone, completely face have been changed and all. What are the care we can give? We can give the prevent the contractures, ROM exercise, scar management or scar compression, and psychological rehabilitation of the patient in the cases of burn. Next is post cataract surgery of nursing care. So cataract is a clouding of the eye lens, okay, which is surgery. The surgery involves the lens remover and the IOL implant. Okay, lens implant it is a. So the cataract is mainly happen after the age of 40, okay, and it is more in men. Okay, we can see the cataract, the disease cataract more in the men. So what is the post-operative nursing care? First of all, eye care, which is avoid rubbing. We have to tell the patient to avoid rubbing, using eye shield and maintaining the proper hygiene. Medication as per the doctor's prescription, we can give the antibiotics and steroid drops. Then discharge teaching we have to avoid lifting, bleeding, okay. Then use sunglasses whenever they will go out. Watch for signs of complications such as pain and vision loss or vision difficulty. Lastly, follow up in 1 week. So this is the main management of cataract. Our next question is nursing management of the congestive cardiac failure. So what is the definition, or what is mean by congestive cardiac failure? So it is actually a failure in chronic progressive condition where the heart muscle is unable to pump enough blood to the heart to the heart and the body to meet the body's need. It results in congestion, which is fluid buildup in the lungs and the peripheral tissue, okay, and the peripheral tissue mainly present in the legs and the hands, okay. What are the causes? The coronary artery disease leads to ischemic and reduced contractility. Then hypertension or high blood pressure increases the cardiac workload. Myocardial infarction damages the heart muscles. Then valvular heart disease, which will disrupt the normal blood flow. Then cardiomyopathy, like arrhythmias, congenital heart defects also are the main reasons of the cardiac failure or congestive cardiac failure. What are the symptoms? The symptoms of the CCF are mainly left-sided failure such as dyspnea, orthopnea, proximal nocturnal dyspnea and crackles, okay. You will able to hear the sound, crackling sound of the heart. Then right side, if it is a right-sided heart failure, then it will be the pedal edema. We can see in the legs, it will be the legs will face the edema. Then ascites. Then jugular venous, in the jugular vein we can see the venous distension, and hepatomegaly or increasing the size of the liver. And other than that, we can also face fatigue, weight gain and reduce urine output. okay, because of the fluid buildup. So these are the symptoms of cardiac failure. So what are the assessments? So as a nurse, we can monitor the vital signs of the patient: oxygen saturation, SpO2, CO2 and all. Then respiratory rate. We have to assess for the fluid retention to avoid edema, daily weight, okay, and urine input and fluid input and fluid output. Then listen for the lung sound such as crackle or heart sound is 3, through which we can understand patient what is the condition of the patient's heart. Then pharmacological therapy, it include diuretics, furosemide to reduce the preload, ACE inhibitors such as enalapril to reduce the afterload, beta blockers to slow the heart rate and reduce the strain of the heart. Okay, whatever the heart that the heart was straining because of the excessive, hypertension and all, no, so it will reduce that. Okay, beta blockers. Then digoxin, which will improve the contractility in some cases and monitor the electrolytes and renal function of the patient. That is under the pharmacological therapy. Now for what are the diet and fluid we can what are the instruction we can give for the diet and fluid maintain? Sodium restriction, so per day less than 2 grams the patient can consume. Okay, then fluid restriction, which is in a day 1 liter to 1.5 liter per day if it is prescribed, then only. Then small frequent meals to prevent the fatigue. Okay, so that is about the diet and fluids. Lastly, patient education. We have to educate for the daily weight monitoring, report if it is gain age 2 kg in 2 days. Okay, more than 2 kg in 2 days. Then medication adherence and side effect of awareness. Lastly, lifestyle modifications such as quitting smoking or smoking cessation, reduced alcohol and physical activity as tolerated. Okay, so our congestive cardiac failure is finished. Next we will move on to the aplastic anemia. So you know what anemia means, but what is meant by aplastic anemia? So it is actually a rare condition that is characterized by the bone marrow failure resulting in the pancytopenia, where there will be decreased amount of blood cell, white blood cell and red blood cell, okay, and platelets. So why it actually happened? It happened because of idiopathic, which is the most common, like there will be no proper reasoning or proper cause. Okay, a particular cause will not be there. Then drugs like chemotherapy, okay, or chloramphenicol, using of chloramphenicol drug, it can happen. Radiation exposure, viral infections such as hepatitis, HIV, EBV or Ebola virus, and autoimmune diseases are the main reason of the aplastic anemia. Then symptoms. So what are the symptoms? Symptoms include fatigue, pallor, dizziness and tachycardia. For the leukopenia or leukocyte amount decrease when it will happen, then will be frequent infection and fever, and if it is thrombocytopenia, then there will be bleeding gums, fatigue, bruising and prolonged bleeding of the person. Now nursing management. So how a nurse will manage this kind of patient? First one, we have to prevent the infection. We have to maintain the strict hand hygiene, protective isolation, avoid crowded areas, visitors with infections. Then use the prophylactic antibiotics as per the doctor's prescription. Then prevent the bleeding. To prevent the bleeding, we can go for avoid IV and IM injections when possible. Use the soft toothbrush and electric razors. Okay, then monitor for signs of bleeding in the stool, urine and gums. Then manage the fatigues. To manage the fatigue, we have to encourage the rest period and avoid the overextension. Then blood transfusion as ordered for the anemia. Nutritional support such as giving iron, folate and protein rich food. Lastly, excuse me, I'm very sorry for that. Okay, so lastly, for the education and support, we can educate on the bone marrow transplant and immunosuppressant drugs we can give. Address the psychological distress and fear and regular follow-ups in the also along with the lab monitoring. So this is the nursing care that we can provide to the patient with aplastic anemia. Next is disaster management and nurses role. We have seen the triads, right? We will see what is the disaster management. So there are different principles in disaster management such as preparedness, mitigation, response and recovery. What happened in the preparedness? Just before that we have to plan, train, organize the resources. Okay, in the mitigation we have to minimize the risk before the disaster, not after the disaster will happen. Then response, when the disaster will happen we have to give the immediate action to save life and provide the care of the victims, then or the casualty. Then recovery, we have to restore of the normalcy and rehabilitation and support of the casualties. Okay, then stages. Now in the mitigation what actually happen, or as a nurse what we actually do. So in the mitigation as a nurse we have to identify the vulnerable areas and the population where the disaster will hit hardly. Then strengthen the health infrastructure, okay, like informing PHC, UHC, okay, or informing the NGOs and all to give the support along with the government. Then conduct public awareness campaign regarding the disaster. Then preparedness, we have to do the disaster drills, mock drills and all. Okay, then simulation, nurse training in the basic life support, triage and infection control. Lastly, stockpiling the emergency supplies and contact list. Okay, so this is for the preparedness. So these two stages are mainly we have to do before the we have to